Hey, Institute family. Well, this is Jared Zimmerer, the director of the Word on Fire Institute. And if you were paying attention in the forums a couple of days ago, I reached out to everybody in the forums and just asked, if anybody has any questions regarding what's going on with this coronavirus, or what some are calling it COVID-19. I'm sure all of us are kind of bunkered down right now, or at least hopefully you are, and staying safe out there. But what I thought I'd be able to do, we've actually got a blessing to have Dr. Tod Worner on our team. Not only is he the editor of the Evangelization and Culture Journal, but also he is a medical internist. So he's the perfect guy to bring on and ask some questions about this, everything going on. And so, Tod, great to have you here, man.
Jared, it's so good to be here. And by the way, if I can get this video and rewind it, you saying the perfect guy, I'm just going to have that played over and over on a loop for me, just so I can keep my ego going. So
there you go. Oh man. Well, to start off, maybe share a little bit about, they know you as the editor of the journal, and so
sure.
maybe share a little bit about your practice and kind of how you got into medicine.
Well, thanks. Yes. So I've been practicing internal medicine. I practice up in Minneapolis. I've been practicing for about 17 years now. I went through the University of Minnesota Medical School, did residency at this place called Abbott Northwestern Hospital in the Twin Cities here, and I've been practicing inpatient and outpatient medicine for a number of years, and I've largely contracted to an outpatient practice, largely because I'm doing more teaching of medical students, residents, some administrative work. So my patient population is a bustling patient population of anybody from 18 to 108. I don't have any 108-year-olds right now, but the long and the short is the people that we're concerned about being at highest risk for complications and hospitalizations with COVID-19 are kind of the bread and butter of my patient population. So it's been a joy to have that aspect of my life, very vocational, very calling oriented, to be kind of paired with the work I'm doing with Word on Fire in the journal. So I appreciate you having this conversation about this at this important time.
Yeah. How much has your work changed since all of this has happened?
It's amazing. It's amazing. I imagine, like everybody, you look at any organization and you think about going from face-to-face patient meetings down to telemedicine, where basically right now we're doing an incredible amount of phone calls, conversations, managing of chronic medical illness, acute medical illness over the phone. And I was thinking and talking to my neighbor the other day about this, obviously keeping our appropriate distance. But the long and the short of it is saying the kind of change we've gone through in the last 2 weeks in terms of the way we're practicing, and I imagine the way people are doing other businesses, if you would have let it just kind of fall into the hands of the bureaucracy to move this kind of slowly forward, it would have been a 2 or 3 year process. But necessity is the mother of invention, and we find that within 2 weeks, you're practicing medicine in a completely different way. So it's been eerie. We in Minnesota are waiting. We've seen, obviously, we have some COVID-19 patients within even our clinic population, but I think the surge, like in many other places, is coming. So it's a little bit of a quiet before the storm right now. So that's kind of been what's been going on.
Okay. And now some of the questions that we had from our own members, some of them that kind of go specifically into the virus itself, and then also we'll get into a little bit about maybe some reliable sources where people ought to be going, and et cetera. So first off, let's kind of get into the ins and outs of the virus itself. So one of the questions was, what does this virus do to the body that makes it so much more dangerous? And I'm guessing more dangerous than maybe the average flu. And what has happened to the people who have been put into ICU because of it?
You bet. So as we all know, I mean, viruses are a part of all of our lives. We have, runny noses and coughs and sinus congestion and earaches and body aches and low grade temps. I mean, it's something that's just commonplace for our kids, for our parents, for ourselves. And we just, think about the number of viruses that are out there that never go reported to a clinician, people aren't going to the hospital. They're just kind of blowing their nose, taking their cough drops, maybe, going to bed a little bit early, taking some Tylenol. Coronavirus as a class of viruses is one of the many viruses we have that cause just low-grade upper respiratory or sinus types of infections, along with rhinovirus and other types of viruses. What the viruses oftentimes do is they'll basically come into your system through the most easy place to effectively adhere themselves to. So in the coronavirus, the COVID-19 virus in particular, It comes through the nasal passages. It can come through the eyes, actually. It can come through the throat. And it basically embeds itself in the mucous membranes, and it finds its way into the cells in your body. And it basically is a hijacker. These viruses are hijackers. They effectively find a way to access the inner machinery of the cells, move in there, and they take it over, and they use that cell as a manufacturing plant for further virus production. Well, like I said, the majority of what we have out there for viruses that we run into are run of the mill, and our body is incredibly adept at managing them, and they kind of go away. The problem with the coronavirus is it seems that it's novel in the sense that it's not something that most adults, I mean, almost all adults, have encountered this particular brand of coronavirus before. So whereas a lot of the other viruses out there may come in maybe a variant of what we've experienced when we were children, so we have a certain amount of immunity to moderate it, this one seems new. And as a result, our body is not quite prepared to respond to it in a deft way without causing a lot of problems. What happens with this coronavirus is it seems that, especially the people that get very ill and end up in the hospital, is it sets off what's called a cytokine storm. So cytokines are basically inflammatory markers or if you will, humors or chemicals that our body creates to fight off infection, to raise our temperature, to kind of kill the virus, make our bodies inhospitable for this. The problem with this is that sometimes the body can get jacked up to such a level that the immune response is actually damaging to the body itself. So what many people have read about and many people already know, I want to reinforce. There are going to be a lot of people who get this particular coronavirus, the COVID-19 diseases coronavirus. And the long and the short of it is they're going to get it. They're going to feel crummy. They're going to feel like it's influenza. They're going to be at home taking Tylenol, and they're going to be licking their wounds after a number of days. And then they're going to get better. They're not going to see their doc. They're not going to go to the hospital. They're not going to be on a ventilator. They're going to get better. But for a subset of patients that end up in the hospital and get severely ill, one of the things it causes is something called acute respiratory distress syndrome. And acute respiratory distress syndrome is basically an inflammatory assault on the lungs themselves, where the lungs basically become leaky, if you will, and inflammatory debris kind of seeps into the lung air spaces. And with this fluid and inflammatory debris, it basically obscures the ability for oxygen to get from the air penetrating into the bloodstream. And so people become very, very ill. And ARDS, acute respiratory distress syndrome, is sort of, it can be a manifestation of a lot of illnesses. If someone aspirates, if they vomit and aspirate and get acid into their lungs, they can get a terrible chemical pneumonitis that could end up being ARDS. For other people, there can be bad infections. There can be drug reactions that can cause this. But this is typically ARDS is a terrible illness that has a high mortality rate because so much of it is just managing the symptoms and managing the person on a ventilator until the body tames down that cytokine storm or the inflammatory debris starts to resorb. So the point is, I'm going long, sorry to give you multiple paragraphs for a one.
No, it helps. Yeah, it's very helpful.
But the bottom line is this virus at its worst seems to be stimulating this huge inflammatory response, which really impacts the lungs, which as a result, because of the damage in the lungs, ultimately can have an impact on other parts of the body: shock, low blood pressure, kidney dysfunction, and there's also some manifestations of cardiac disease. So people can actually end up having heart attacks in the process. They can have their heart where it becomes less efficient of a pump, so they go into heart failure. So it's newness to us as a novel agent, number one. And number two, it's aggressiveness in us that leads to a significant inflammatory response. And then the subsequent multi-organ damage it can do is something that is really frightening to us, and is why we're taking this so seriously.
Okay. And one of the other questions is, and you mentioned it a little bit there, of the role of a ventilator. That has been popping up in the news constantly about the need for ventilators. What would you say is, I mean, number one, what's the need of it? What does it do? How does it help? Is it different in the sense of, because one of the questions is this kind of like a corona like pneumonia, or is it different than like a pneumonia? And then third, how is the ventilator able to help?
Yeah, it's a great question. Very nuanced. First of all, it's amazing how many people are now becoming aware of how many ventilators there are in their state. I mean, that's not something that's top of mind for most people. Like, what's the number? And we're going to talk about why that matters with respect to this and about the notion of flattening the curve and what that means and so on. The long and the short is that people, so there's two things. Number one is that you can simply get a viral pneumonia where you get a lot of inflammation, irritation, and pockets of viral infection in the lungs themselves. And usually, if you look at CAT scans on people that have this coronavirus, you see inflammation, what's called ground glass opacification. If you took glass and you shattered it on the ground, and then you took a rock and you ground it into little fine parts of dust, that's what it looks like on an X-ray or on a CT scan. And the bottom line is it's peripherally oriented on both lungs. And the bottom line is so you can have real significant infection and inflammation in the lung tissue itself. That's the infection itself. The body's response to the infection can lead to what's called the acute respiratory distress syndrome. So one is a little bit more of the initial insult, and the other is more of the body's reaction to that insult. The ventilatory response, so why we need a mechanical ventilator, if someone is having a hard enough time breathing, first of all, they labor immensely, and they can really they can start to lose their capacity to ventilate, to move the diaphragm up and down and get enough oxygen. Because if you don't have enough oxygen, you're going to hyperventilate. And imagine hyperventilating for a week straight. You just can't. You can't do it for an hour straight without fatiguing and starting to get into the risk of respiratory failure. So first thing is the vent. When a person is put on a ventilator, they're literally sedated, and they put an endotracheal tube down and into the trachea, and they put you on a machine, and they program the machine to how fast a person breathes, how much air is pumped in at any particular time, how much inflation of the lung there should be at the end of every particular breath. And the bottom line is what this does is it secures your airway so that you're not at as high of a risk of aspirating stuff up if you're coughing and you're losing consciousness. It secures your airway with that tube, number one. Number two is it allows you to rest a little bit, and it breathes for you. And as someone is weaning off the vent, you take off some of those settings and allow the body to do the breathing for it. But when a person is really sick, this machine is programmed to give you breaths and to give you enough of this. The third thing is it gives you oxygen. No matter how much we're trying to breathe I think it's 21% oxygen that's in the ambient air out there, this will give you up to 100% oxygen, which is a significant amount that basically is just trying to overpower the obstructive debris that's in the lung itself and get as much of it in there as possible by just sheer amounts of concentration and diffusion. So it's airway protection. It provides rest, and then subsequently it provides a significant amount of oxygen. Now, the one thing I'll tell you too, Jared, is that some people initially thought, well, why don't we use BiPAP or CPAP, these blower masks on people that people use for obstructive sleep apnea and things like that? Or should we use high flow, non-rebreather oxygen masks? It's in other circumstances, it would be a good idea. The problem is it blows this infection everywhere. And so if you're in the room taking care of people as a physician or as a nurse or as a respiratory therapist, you do not want to get infected. And you have all this, this personal protective equipment on. You don't want to be blowing that around, so there's risk of it getting amongst you, getting out into other patient rooms, et cetera. So that's kind of a summary statement, I guess, of why the ventilator is necessary and what it sort of does.
Okay.
Does that make sense?
Yeah. Oh, yeah. It makes perfect sense. And I guess it also makes sense, especially with, as you said, you're basically keeping people from getting infected themselves by it blowing out as opposed to it actually going down the throat. So, so one question too is actually kind of just more on a practical level. It says, if I have been exposed to this virus, did not develop any symptoms, say dry cough, high fever, fatigue, etc., and I've stayed home for 14 days, do you have an immunity? What does it take to get maybe an immunity to this? And as far as, since there's not really an antibody or a vaccine out there right now, what are the steps that we need to take should we start to see the symptoms?
Yeah, it's a great series of questions. If you've been exposed, it doesn't necessarily mean that you've gotten so let's say you get exposed and you spend 14 days in quarantine and you never have a lick of symptoms. It could mean a couple of things. It could mean that, yes, you've been infected, you had such a mildly symptomatic or asymptomatic state, and that ultimately your body will develop antibodies that at some point will have a way of serologically testing for that, and that presumably, at least at this stage of the game, our presumption would be that you would be immune to this particular virus and its attendant effects from being infected again. Simultaneously, it could be that you weren't infected, that you you were exposed, but technically you didn't get infected in the process, so you could be just as vulnerable going forward in the next scenario. So I guess it's sort of one of those kind of things that I would say in the short term, if you feel like you've had an exposure, you should do exactly what you just described. You should spend that time in quarantine, 14 days in quarantine, looking for symptoms. And the problem you run into with this too, Jared, is that the symptoms, we think the incubation period is about 4 to 5 days before symptoms arise. And then it's usually even out to 10 days before someone could potentially really start taking a downturn. So there's some people that might have a fever, they might have a cough, might be achy, and so on and so forth for 3, 4, 5, 4 days, and they're like, well, I feel good, but I'm really doing okay. And then they start getting worse by about day 10, day 11. So that's the reason why there's this long process of staying at home and quarantining oneself. Let's say you did get infected with it. Let's say it was mild, and you spend your time in 14 days in quarantine, and you're doing much better. I guess what I would simply say is unless you're sure that you've had it, you should continue during this time to act as if you haven't. Maintain that social distance. Maintain some of the personal hygiene things. If you're ordering things out, just do the proper wiping that's necessary. Don't go in crowds and all this kind of stuff. If you do get infected, the bottom line is there's still some different metrics in terms of what is necessary to deem someone clear. Definitely want a person to be afebrile, so no fevers. Definitely we don't want to have them having cough. We don't want to have them having shortness of breath. And there's varying recommendations about how long do you have to be out from. Some people say 7 days out from your last symptoms. And there's some studies that are saying, and there's your small studies that are saying we should swab people twice to demonstrate they have negativity on two swabs 24 hours apart to basically declare that they are no longer infectious per se. What I'm saying to most people right now is we're on the front end of this. While we're still having a lot of policies that are based on China and South Korea and Italy and increasingly other places, we're learning at the speed of light about how this looks, how infectious people are going forward, what's the recovery time take. So I'm just simply saying, for now, play it safe, keep the social distancing at appropriate levels, don't panic, and let's just watch and see what the literature shows us in terms of the other side of this as we're kind of ramping it up.
Okay. And that goes into some of the next questions, which is more about the kind of proper reaction to this. And one thing you just said is we're learning at the speed of light. So as far as reactions are concerned, it's kind of, sometimes it's a hard thing to know until hindsight, what is the right reaction to some of these things. But one question is if healthy people are fine as long as they practice good hygiene, isn't there potentially more danger by forcing physically healthy people to stay indoors indefinitely, given that there's potential other problems that might come from that?
It's funny because you and I were just talking about a variant of this question before we went on the air. I think the one thing I think we should really reinforce is I think maintaining a healthy lifestyle is essential. We don't want people to go into the kind of the shelter in place or staying at home and so on, and end up eating 4 bags of chips a day and watching Netflix and becoming part of the furniture. I think the key is right now, unless you have a state recommendation of a shelter in place, which a lot of places are that way. In Minnesota, it's not an official one, but it's basically saying let's just do as much attempts to stay at home for 2 weeks. But still, you go out in your driveway and hit tennis balls around with your kids, or play catch, or work out like you lift weights in the garage, sit on the deck, and maintain your social distance from non-family members, neighbors, etc. So I think it's very true that we got to keep our heads on here and saying we should continue eating well, we should continue exercising, we should continue getting fresh air. If you can go for walks on paths that don't have large quantities of people and don't have a shelter-in-place order, and you're going to get back home and it's in keeping with your state's guidance, I think it's very reasonable. We are designed not to be bunker people, and I think for the sake of not having massive quantities of people or crowds that are passing it between each other, that's the right thing to do now, because we're trying to keep the system from being overwhelmed with illness, so that people literally are being triaged out of getting ventilatory help. That's the big problem right now, is public health measures to prevent us from being swamped. But generally speaking, lead a healthy lifestyle, get some fresh air. If you can, go for walks, with family, without other people. It's not a bad idea as long as it's faithful to the guidance of your state. Don't forget, you got to stay human, and we don't know how long we're going to be like this. So maintaining those human habits, I think, is key.
And what are some of the key reasons as to this reaction of the staying at home and everything? When you look at the numbers of some of the things that kill us every year,
yeah,
why is it that this one is particularly so dangerous?
It's a great question, and you look at influenza and you think. I was looking at the CDC to see kind of what is the 2019 2020. What is the number of incident? What's the incident so far? 38 to 54 million episodes of influenza just this year alone. And you think, well, we're looking at the ticker on the news channels or on the Johns Hopkins Coronavirus Resource Center, and it's saying we have 300,000, or I can't remember what we're up to right now in terms of internationally. But the long and the short of it is and things like malaria, HIV, Ebola in those particular areas. The concern about this one is not that these other infections don't matter, not that they don't pose their own public health risks and so on, because they do. The concern we have right now is the rapidity, the speed with which people can get critically ill, and the speed with which the infection can spread can overwhelm the carrying capacity of hospitals to help save these people's lives. What's happening in Italy when you see mortality rate is it's not just mortality rate because everybody got care, everybody who needed to be on a ventilator got on a ventilator, and these people who were so sick, despite the best care possible, died. It is that the hospitals are overwhelmed and certain people are being triaged from not even getting a chance on a ventilator. And so the point is that there's this whole graphic, which I think is a wonderful graphic about flattening the curve. When you have X number of ventilators out there, if you get a bolus of people that goes so high that requires the very far end, the most aggressive form of hospital care possible, and you have X number above the carrying capacity, above the ability to service them, you're going to have a lot of needless deaths. And so in doing a lot of the measures that we're doing right now, by slowing the spread, we may ultimately have the same number of infections, but it may give, and I think we'll have less infections, honestly, with some of these measures, but it may give the people who are infected and critically ill a better chance at life simply because they have access instead of losing that access.
And speaking of some of the resources, one question was, what are some of the reliable sources of information in regard to actual infection rates, death toll, places where they can go? And because it does seem like, unfortunately, and it's partially a learning curve that we're dealing with, is there sometimes can be mixed messages. So which sources would you recommend?
The one I really liked a lot, because I think it's really neatly done. It's kept up very well. As I'm looking at it right now, is the Johns Hopkins Coronavirus Resource Center. And if you see most of the tickers on most of the news channels, they are using that. It's Johns Hopkins Coronavirus Resource Center. It basically breaks down country to country what the numbers are, and it basically shows you all the different, whether it's WHO, CDC, and other trackers to let people know what it is. Now, what I would recommend is don't spend tons of time watching the news and don't spend tons of time on the Johns Hopkins Coronavirus Resource Center, because we're going to talk about the same thing towards the end of this interview, but we need to keep our heads on straight about this. One can get inside their head. One could think every time they have a tickle in their throat, it's the beginning of the fatal ramifications of the coronavirus and so on. So I think we need to look at this and say, if we were doing this with influenza, if we were looking at the numbers of influenza, we would be absolutely petrified, because the numbers among influenza is astounding. It's immense and astounding, and it happens every year. So it doesn't mean that we don't care. It doesn't mean we don't want to flatten the curve. It doesn't mean we don't want to have the precautions we're talking about. It's just that let's identify those things that we can control and those things we can't, and let's not make ourselves crazy about the things we can't control. The other thing I'd say is, if you're interested, if you're kind of wonky, or if you're a healthcare professional, Up to Date, it's a subscription service for physicians. Up to Date has great information about coronavirus, which is being updated per its name very frequently. Another one is called Medscape. Medscape, and it basically is largely for physicians, but it's got really good literature drawn from the New England Journal of Medicine, the Journal of the American Medical Association, Annals of Internal Medicine, and it's articles deciphering what this stuff means. And I think literally you just put your name in there. I have a subscription to it, but it's free. Medscape is what it is. So be careful about every news person's interpretation of this, and be careful of statistics, because there's a lot of manipulation of statistics. And I hate to say it, and Jared, you alluded to this, we don't know what's going on in China right now. We don't know, because China is an authoritarian regime, very interested in maintaining a world presence. They want to seem like they're I hate to say this, but they want to represent themselves in many respects as being the adult in the room in terms of managing this, controlling this, and so on. And I think I'm absolutely stunned at the notion that they have capped out at 80,000 in a country of 1.5 billion, when the original epicenter had 5 million people that left before the quarantine was put in place. So I would just say I would be careful about interpreting what's coming out of certain countries, because they might have a vested interest in not testing, not reporting, and kind of bending the narrative in a way that isn't completely consistent with the truth.
Yeah. And now I kind of want to get into some of the kind of more, and you started getting into that as a good doctor of helping people deal with maybe the fear, the anxiety of it, and some of the practicalities of be aware of how much time you're actually paying attention to the news with all of this, and realize that there are certain things out of your control, things that we can control, like hygiene, staying at home until your government allows you to go back to what you can do. But what are, some of the, Bishop Barron did such a great job on the recent Word on Fire show, and I recommend, if anybody watching this has not heard that or watched it, go watch it. That's, an apostolic father providing some guidance here. But I thought, as a medical professor in the medical profession, as well as a devout Catholic, a father, a husband, what kind of maybe spiritual advice can you offer during this time?
Again, really thoughtful question, Jared. I think, if I can, I think we need it's, and I think it's poorly attributed, the prayer of I think it's the prayer of Saint Francis, the Serenity Prayer. I mean, literally us identifying that which you can control, that which you can't, and the wisdom to know the difference between the two. We got to remember, with this particular virus, the vast majority of people out there are going to be okay. They're going to be okay. There are going to be people, once it's demystified and people experience it and feel crummy, and I hope as few people will experience it as possible. But there's a number of people who are going to feel a bad influenza type illness, and they're going to not be hospitalized. They're not going to be on the ventilator. They're not going to pass away, and they're going to be okay. And they're going to look back and say, that was miserable, but I'm glad it's done. And I guess, okay, I've experienced it. The second thing is that the mortality is not 50%. Once upon a time, the Middle Eastern respiratory syndrome, MERS, had a 36% mortality rate. SARS, the severe acute respiratory syndrome, had a 10% mortality. I'm not diminishing this mortality rate, which is it ranges generally. I think it's 1.2, 1.3 in America right now, and it's 0.9 in South Korea, and it's 7.4, I think, over in Italy. I'm not minimizing that, but what I want to say is the vast majority of people out there are going to be okay. So take a deep breath. Take a deep breath. The second thing is what's interesting is I think we are being asked to hunker down with the people we love the most. We're close to the people we love the most, and we're also communicating from afar with the people we love the most. And it's amazing, because I think more than I have ever seen, probably in the last 20 years of my life, I see more people playing basketball in the front driveway. I see more people waving from a deck to the other person, saying, "How you doing? How you handling this?" I'm stunned by the fact that my lights are still on, that my plumbing still works, that the grocery store, notwithstanding the toilet paper runs, is still well stocked. That there's someone at the cashier that smiles and, as I've written recently, double bags something of mine so it doesn't crash out in the parking lot. I think the spirit of what it means, and by the way, the Wall Street Journal had a great article yesterday about all these companies just stepping up to instead of making cars like GM, to make ventilators, and people going to work at Amazon and all the truckers and sanitation. My garbage was collected today. I mean all these people willing to do these things. It shows the incredible spirit under crisis of people willing to pitch in for something bigger than themselves. It isn't Mad Max. There are people that want all the toilet paper. Okay, I get it. But there's more people that want to do great things for their fellow man, fellow woman, and I think it's wonderful. So spiritually, if I may offer this, as we're spending more time with our family and playing board games and cards and shooting hoops and maybe we can find time to be more prayerful. Maybe we can find time to actually turn off the news that kind of gets us worried, and read works of the great saints on the contemplative life, on prayer. Do more praying as a family, watching Mass, your local Mass online, knowing that you have a whole community of people tuning in and hungering to taste the Eucharist that they're missing. So I just think it's a forced retreat in some respects. Yes, it's a nervous one because everybody's worried, but the bottom line is it's a forced retreat to turn down the frequencies in our lives and to reclaim that which matters the most. And the first and foremost is faith and family.
That was wonderful. It reminds me a lot of one of our patrons is Therese of Lisieux, and her whole spirituality was the little things. And talk about the opportunity to do the little things right. I mean, right now is the opportunity to show those little acts of love with your family. And I'm sure it's in your family as well as mine right now. We're already getting a little stir crazy because we want life to get back to normal. So it gives you even more of an opportunity for patience, kindness, those little acts of doing things for each other, for your spouse, for your kids. And so it actually, and Bishop Barron alluded to this as well in one of his other videos about this is an opportunity to be a saint just as any other opportunity. That no matter what the situation, we are called to be saints. And so this is an opportunity for us. And maybe God's telling us to take a big, deep breath right now and realize what's important.
Well said. Couldn't agree more.
And I guess to kind of finish off on a light note, and also for anybody watching, certainly any more questions that you might have, go to that forum in the forums, and I'm sure, Tod, you'd probably be more than willing to go in and answer any other questions in there in a written way. So just to kind of finish off on a light note, earlier this week you had a blog post on one of your recommendations, and you kind of alluded to it just a second ago on getting back to some of the classics. And looking at our backgrounds right now, it looks like books are kind of part of our life anyway. But I thought that I'd love to just kind of finish off on talking about something hopeful that we can do during this time. And I love that recommendation. So why the classics?
Well, I appreciate Jared. Now you're a fan of this, just like I am. And by the way, for those who are watching, Jared and I said we figured we could fool people into thinking we're sitting across from each other in the same library. But alas, he's in Texas and I'm in Minneapolis. I think that's safe social distance. I think the classics. The thing I think about the classics is they've endured for a reason. It's not just because they have good PR. They endure because they speak to the universals in us. Fear and anxiety and heroism and tragedy and hope and loss and suffering. Those are not things that go out of style. And it's interesting because we live in such a politically charged, snarky culture in many respects. And yet Dostoevsky and Jane Austen and Charles Dickens and Dante and so many bright and brilliant thinkers, Charles Dickens, they have things to say to us. And the other thing is that they didn't live, they had a lot of distractions of their own. I get it. But they found a way to talk about the intriguing and entrancing aspect of what it means to be human. And they bring these figures to life. And I think if anything we're finding in this kind of bottleneck, harrowing experience of our own lives is we need to better understand who we are called to be. What is the better version of myself than I was before all of this? How do I understand suffering and my role in God's kingdom in the midst of suffering? And I think the classics, whether it's Anna Karenina or the Divine Comedy or King Lear, can speak so eloquently to these things. I will also say, if you like modern fiction, good for you. The one thing I'll say is most modern fiction is a total ripoff of the classic fiction that was told 150 or 200 years or 800 years before it. And so I would say go to the original. Don't be intimidated by it. And just because you didn't like it when you were an 11th grader and your teacher asked you to guess what I'm thinking and write a blue book essay on a book you had to cram in 1 week, it's going to be a different experience because you are a different person now. And read it and just immerse yourself in the story. And while we're at it, read the spiritual fathers, read the saints, read Job, and read things that are hopeful, and watch a good comedy on Netflix. Laugh. This is a time not of dreary, just sackcloth and ashes. It's a time of joy to find ourselves in the midst of trying times.
Praise God. Well, Todd, if you don't mind, maybe we'll end in prayer. And as I said, anyone that's listening, if you have other questions, please go into the forums. We'd love to continue this conversation. So why don't we end in prayer? In the name of the Father, and the Son, and the Holy Spirit. Amen. Jesus, we ask you to bring all of us closer to you, particularly you on the cross. We ask you to take this time of maybe abstinence, of giving up things that we tend to take for granted, so that it brings us closer to you. Bishop Barron once earlier recommended that now's the time to ask the big questions. And I think the best questions that we can ask are from you. So we ask you to bring us closer to your heart, closer to the suffering that you gave in your passion for our salvation. Blessed Mother, we ask that you wrap us in your mantle. And Fulton Sheen said that you could form us in your womb so that we come to look more and more like Christ. Take each one of us watching this video to as close into your womb and form us into the image of Christ. Be our intercessor during this time so that we can gain the graces that are offered during this trying time, both as individuals, as families, and as a church. Help us to recognize that no matter what the time is, we are all called to be saints, and we're all called to evangelize, whether it's in our own homes or it's in a wider audience. Saint Joseph, protector of the church and terror of demons, bring us closer to your foster son and help us to understand your role as the protector of the Holy Family. We ask all of our heavenly intercessors, St. Thomas Aquinas, Therese of Lisieux, John Paul II, to intercede for all of us during this time as our heavenly friends. Amen.
Amen.
Our Father, Son, Holy Spirit. Amen.